Okay, good morning. I hope we are all fine.
Good morning, sir.
Good morning, sir. Yes, please. How about you?
I'm fine. I'm fine.
Thank God.
Yes. Today, you see, last week we did proposal writing. I took you through how to write a proposal. This week, we are going to review someone else's proposal and see what the person did wrong, what the person did right, so that when you are doing yours, you would know what you are not supposed to do. You would know what you are not supposed to do. So for this week, we are going to review someone's proposal and then see how the person went about it. Where the person got it wrong, it will serve as a point of correction for you. And where the person got it right, we will use that to at least support what we were doing for ourselves. I've told you that after our discussion on proposal, you will have 3 weeks to submit your research proposals to me. So that means that after today's class, you will have 3 weeks to submit your proposal. Today is on the 8th. So that means by 29th of March, you should have submitted your proposals. By 29th of March, you should have submitted your proposals. And I know that by now, almost all of you have formed your groups. Almost all of you have formed your research groups. So with that, your group, I am hopeful that by now you have an idea of a topic you want to work on. You have an idea of a topic you want to work on.
Mute yourself.
So that means that by the 29th of this month, you should have done your proposals and submitted it to me. Today is just for review, so I don't expect us to spend too much time here. But then I would want volunteers to help us in reading the proposals. Do we have anybody that's going to volunteer to read for us? Is there any volunteer to read for us?
Yes, sir.
Okay, so Josephine, I think you volunteered. Josephine, please help us read this proposal that is on the screen. Can you view it well? Can you view the document on your screen well?
Yes,
or do I need
sir.
to enlarge it?
No, it's okay.
It's okay. Okay. So please, Justina, take us through. Josephine, sorry, take us through.
Okay. Good morning, class. So, Garden City University College, Faculty of Health Sciences, Department of Nursing and Midwifery, research proposal on. I can't
So
see
pause. So now, I hope everybody is paying attention. If this person submits their work to me, they're already losing marks. Starting from the name of the institution. The name of the institution is no longer Garden City University College. It is Garden City University. So this college should not be there. This college should not be there. So this portion, they're already losing marks. Faculty of Health Science. It is no longer Faculty of Health Science. It is Faculty of Health and Allied Sciences. Faculty of Health and Allied Sciences. So -2 here as well. Then department. It is Department of Nursing and midwifery, not slash midwifery. Department of Nursing and midwifery. So another 2 marks being lost here as well. And then please, my people, tell me, is this the correct spelling of proposal?
No, sir.
This is not the correct spelling of proposal. So this person has also lost 2 marks here. So the person has lost just in the cover page -2, -2, -2, -2. So 8 marks lost already. How much is the person going to get in the first place for the person to lose 8 marks only in the cover page? So please, when you are writing, open your eyes. When you are writing, open your eyes. Good. So let's look at the topic. Josephine,
Yes, sir.
go on.
Factors influencing unsafe abortion practices among teenagers at Asankragua.
Okay. So this person is working on factors influencing unsafe abortion practices amongst teenagers at Asankregua. So please let us keep this topic in our mind whilst we go through.
Okay.
This person has gone ahead to give us a table of contents. And in their table of contents, they show that the introduction will contain the background of the study, the problem statements, the aims of the study, the main objective, specific objective, the research question, the delimitation, and definition of terms. In their methodology, they said they would have introduction to the methodology, the study area, research design, study population, inclusion, exclusion criteria, sample size and sampling procedure, data collection procedure, data analysis, ethical consideration, validation and reliability, expectation, conclusion, references. This is what this person is saying is part of their work. But even in this, their table of contents, there is a problem. If you look, this person has only 2 major segments. They have the introduction and the method. It's the conclusion and references, the expectations, conclusion, references. Are they supposed to be part of the methodology?
No, sir.
No, please. It has to stand on its own.
They are supposed to stand on their own. But this person has included the expectations, the conclusion, and references as part of the methodology. So here 2 -2. We haven't started reading the main work, and the person has really lost 10 marks. We haven't started reading the main work, and the person has already lost 10 marks. So the expectations, the conclusions, the references are supposed to stand on their own. They are not supposed to be part of the methodology. They are not supposed to be part of the methodology. Good. So this is a note to you when you're doing yours. So with this, Josephine, that's true. But whilst you are reading, everybody please pay attention so you can spot the relevant stuff that are supposed to be there. And note that when we discussed the introduction, we said that it is supposed to pique the interest of the reader. That means that when you read the work, your interest is supposed to be piqued. You're supposed to be interested in what the person is saying and to understand what the topic is all about. Okay. So Josephine, please take us through. But whilst Josephine is reading, please, if you are also interested in reading, you can kindly comment your name in the chat so that, or say that you want to indicate your interest in the chat so that when Josephine is done, you can take over for us. So please, anyone else interested in reading for us, please indicate your interest in the chat. But for now, Josephine, please take
Yes,
us through.
Sir, please,
introduction.
can you zoom the it's for us small? It's too small.
Is it okay now?
Please.
Okay. So please, Josephine, take us through.
Background to the study. Women throughout the world are faced with issues of unwanted pregnancy. Some of these women seek to get rid of the pregnancy by safe medical means if available, while others resort to whatever means that is available regardless of its safety. Abortion, whether safe or unsafe, is a common event worldwide. Approximately 1 in 4 pregnancies end in an induced abortion, and half of these induced abortions are deemed unsafe during the period from 2010 to 2014. Ganatra. So should I mention those names or I should leave
No,
it?
don't mention.
Okay. Induced abortion has been in existence even before history started recording it, and it is existing and it's performed with highly varied techniques and under different circumstances environment. In Ghana, it is illegal to perform an induced abortion, but there are a number of exceptions within the law that make it more accessible than in many developing countries. The performance of an induced abortion by persons lacking the necessary skills or in an environment that does not conform to minimal medical standards, or both, is regarded by the World Health Organization, WHO, as unsafe abortion. Unsafe abortion can also be termed as clandestine abortion since it is mostly done secretly either by the pregnant woman or with the assistance of another person or persons. According to oh
Don't worry, skip the names and move on.
unsafe abortion is one of the neglected problems of healthcare, especially in developing countries such as Ghana. Globally, the number of induced abortions seems to be reducing, but the estimated number of induced abortions in Africa has increased from 1995 to 2003. In South Africa alone, it was found out that 425 women die annually in public hospitals due to complications from unsafe abortions. In some parts of Africa, where there are usually restrictive laws or no policies on abortion, induced abortions are done under unsafe conditions, either by self or by untrained personnel. Between 2010 and 2014, about 97% of all global abortions occurred in low-income countries. The percentage of unsafe abortions being practiced are higher in countries with highly restrictive abortion laws when compared with countries with more liberal laws. It must be noted that even in countries where abortion laws are liberal, some women still rely on unsafe abortion methods because of existing additional barriers such as onerous facility requirements, long waiting periods, and parental consent laws. Though evidence available shows that self-management of abortions with the use of abortion pills, into brackets, misoprostol alone or misoprostol in combination with mifepristone, can reduce maternal mortality and morbidity. Inadequate information can lead to wrong dosages which will subsequently end in unsafe abortions.
Okay, pause, Josephine.
Yes,
Now, everyone, Josephine has read about 1.5 pages. What she's reading, is it related to the person's topic? Let's go back to the topic again. What Josephine has read that 1.5 pages, is it related to the topic? What do you think?
No.
Sir, please, it's not related.
It's not related. Why are you saying it's not related?
Because the topic was saying factors influencing on safe abortion practices among teenagers at Asankragwa. But then it's like here the person doing the introduction has done it a general thing, not specifically in Asankragwa, but like universal.
Okay. You have a point there. A person has made it universal. But even if the person made it universal and has spoken about teenagers, it would have even been more in line, right?
Yes.
But now the person is talking more general, and then it doesn't really help.
Yes.
Did anybody else notice something else? Did anyone else notice anything?
I noticed that she was specific with the low-income countries. She wasn't directing it to Asankragwa.
Good. Any other comments?
Yes, sir.
Justina, what's your comment?
And the medication she's mentioned, she didn't even indicate whether it's actually in that community that they actually use those commodities or not.
So the medication she
The
mentioned
drugs
was
that she mentioned in that, we don't know whether at that particular community, where did they patronize it?
okay. So should have been specific whether the drug that they are using. She should speak about the drug that they are using, whether it is the one used in the community or otherwise. Okay. Any other comments or any other observation that?
Yeah, sir.
Yes.
Yeah, please. I think that from the topic, she was talking about teenagers, but when you look at the introduction, she's talking about women in general.
Yes. So it defeats the purpose of the topic if she's talking about women in general, instead of focusing it more on the teenagers. Fatahia Al Hassan, hand is raised.
Yes, sir. Please. From the topic, her topic says factors influencing and safe abortion, but when you read through the passage, you can see the factors are not really mentioned. She didn't talk about the topics.
Yes. So after reading 1.5 pages of the work, is your interest piqued in what she's talking about? Are you interested in continuing to read about what she's talking about after 1.5 pages?
No, sir.
No, sir. Making the reading quite boring, right? So if I am not interested after reading the first 3 paragraphs, then you are losing marks. You must make sure that your work, that whatever you are doing, is able to capture the interest of the reader within the first 3 paragraphs. Make sure you've captured the interest of the reader. So let's see what else she is talking about. And let's see whether she's able to salvage the situation later on. I think we ended here. So let's start from unsafe abortion. Josephine, I think you can take a rest. Then let me loop someone in. Good. Yes, Dorothy. Your time is now.
That way.
Yes, sir.
Yes.
So unsafe abortion constitutes a public health crisis, a social injustice, and a violation of women, human rights, and dignity. About 19 million unsafe abortions take place each year?
Yeah, go on. I've muted them. Hello?
Hello?
Yes. Dorothy, please go on.
Okay, so about 19 million unsafe abortions take place each year worldwide, with 70,000 of the women dying, and a further 5 million suffering temporary or permanent disability, including reproductive tract infections and infertility. In Ghana, unsafe abortion contributes to 11% of maternal deaths, which is the second most common cause of death among women in Ghana. Unsafe abortion is entirely preventable. However, it remains a serious public health issue worldwide, and it remains one of the 5 leading causes of maternal mortality, despite unsafe abortion is entirely preventable. However, it remains a serious public health issue worldwide. It remains one of the 5 leading causes of maternal mortality, despite the fact that it is mostly preventable. It has a number of significant consequences aside death and disability. Includes the immediate cost of providing medical care for abortion-related complications, the cost of medical care for longer-term health consequences, lost productivity of the country, the impact on families and the community, and the social consequences that affect women and families. A study by Moat et al. Reported a rate of 21.3% from the Volta region, while another study reported 22.6% in the Brong-Ahafo region. The complications associated with unsafe abortions have serious public health implications for Ghana, as they increase maternal mortality and morbidity and divert limited health resources. Ghana Statistical Services, Ghana Health Services, the government of Ghana had taken steps to reduce the effect of unsafe abortion by providing a safe abortion policy, but the expected decline in maternal death is yet to be realized. Since 1985, the abortion law in Ghana has seen some improvement. Abortion is now permitted in law, provided it is carried out by registered medical practitioners in registered facilities, and where a pregnancy is the result of rape, incest, and the continuation would result in injury to a woman's physical or mental health, or the fetus has a substantial risk of a serious abnormality. The Criminal Code Amendment Law, PNDC Law 102, evidence available shows that tax shifting of safe abortion services reduces maternal morbidity and mortality. Though some previous studies have described abortion law in Ghana as progressively liberal, when compared to other African countries such as Nigeria, Cote d'Ivoire, Mali, it is restrictive when compared developed countries such as Canada, United States of America, and Uruguay. Some studies in Ghana have identified obstacles that continue to hinder the implementation of the abortion law and the policy that is aimed at reducing unsafe abortion in Ghana. Anite and Mihal found that despite the existence of safe abortion policy in Ghana, many health workers and facilities do not see the imperativeness for its implementation because the concept of abortion as sin seem to be common. More studies and similar recommendations are needed in Ghana to give the practice of safe abortion services to the public. Although the Ghanaian government has signed the Maputo Protocol, which states that abortion is a human right for women in Africa, it has yet to fully implement policies such as medical abortion services across health facilities in Ghana. A review of abortion care in Ghana by Rominsky and Laurie. They recommend that there was a need to gather information from women regarding their experiences in securing safe and legal abortions, as well as reasons for resorting to unsafe methods. They further indicate that these experiences of women will enable policymakers to pinpoint interventions that will prevent maternal mortality and other life-threatening complications that occur as a result of unsafe abortions.
Thank you, Dorothy.
Welcome.
Thank you, Dorothy.
Welcome, sir. Welcome,
So
sir.
with this, the person is now done with their background. And still, they haven't mentioned a single word about teenage abortion or abortion amongst teenagers. So the person keeps on talking in general sense, but then without specifying what is going on among teenagers, has the person done a good job? Has the person done a good job?
No, sir.
No.
No, sir.
So if you are supposed to score the person over 10 for their background, how much are you going to score the person?
4, sir.
4 over 10, sir.
4 over 10. 4 over 10.
3 over 10.
3 over 10.
1.
The person...
One, you write your own.
5. 5 over 10. 5 over 10.
5, why 5? 5 is too much. The person didn't
At
say
least the
anything.
person has 5. So it's not easy.
Please. The person had 3 weeks to write this, and this is what they came up with. The person did not do well. Because you see, when you were
For the effort, 5.
well, we're not marking effort, though. We're not marking effort. There's no score for effort. We are scoring what you've written. If you've written well, you will get good marks. And if you realize there were so many grammatical errors in the work. There were so many grammatical errors in the work. And even apart from that, look at this, for example. What is this space here for? The space I've highlighted. Why the space between the 2 and then the bracket? So the person will lose marks there.
Oh, sir, it's typing error, please.
It's not typing error. This one is not typing error. You should have seen it. You should have seen it. Then this is supposed to be a reference. Where is the year? What year was this work published? What year? Ghana Statistical Service, Ghana Health Service. In which year? The referencing is wrong. The referencing is wrong. There is something else I saw where the font size are different. The font size of the this is it. Look at this portion of the text. It seems normal, right? Now compare this portion to this. Font size of where I've highlighted right now is smaller than the ones around it. Do you notice that? Look at it, is font size 10.
Yes.
Look on where the font size is font size 10. But the rest are font size what? 12. So why is this reference font size 10 and then the remaining of the text is 12? Those inconsistencies will not fly. Those inconsistencies will not fly. And then there's something else. Even this referencing that I did here is an incorrect referencing. This is not how we reference. This is not how we reference. And in Garden City, we use APA referencing style. This is not how we do it. This is not how we do it. So referencing is also wrong. But there's something I want you to take note of. And I think I will use this image to explain. Look here. Do you see how the margin on the left-hand side is in a straight line? And the margin on the right-hand side is also in a straight line. This is how we want your work to appear. So this is what to say, it is justified. Your margins are justified. So we want your margins to be justified. If you want to justify your margin, you come to where my arrow is. Do you see where the lines are all in perfect sync? Then you click on it and it justifies the margins for you. This person started well justifying their margins. And then they came to this point. You see, it is no longer in a perfect line. It is no longer in a perfect line. They haven't justified their margin. So this means that I also have to deduct some marks from this person as well. So make sure you are justifying your margin. So in terms of the structure of the introduction, this person's work is flawed. In terms of the content of the introduction, this person's work is still flawed. So there is no place the person is getting marks from. The content of the background, there are flaws in it. The structure of the background, there are also flaws in there. The person has given a lengthy background without any single mention of abortion amongst teenagers. Lengthy background without any mention of abortion amongst teenagers. So now the question is, where is this introduction now, is this background now relevant to the topic? Is it relevant to the topic? And the answer is no, it is not really relevant to the topic. Now let's go down to the page to the student's problem statement. Let's go to the problem statement and see if they are able to salvage the situation in the problem statement. Remember, in the problem statement, what are we looking out for? Tell me, what are we looking out for in the problem statement? What are we to look out for in the problem statement? Hey, my people, did you format your hard drive from last weekend?
Teenage pregnancy.
In teenage pregnancy, where? In Asankregwa, right?
Yes, sir.
So we want to find out what problem is existing in Asankregwa concerning teenage pregnancy. And that problem should be answered by the person determining the factors that are influencing unsafe abortion amongst teenagers in Asankregwa. So let's keep that in mind whilst we read through the work. Dorcas, I think it's your turn.
Say, please, can you maximize it?
Okay, let me
yeah, the lines are very small. Okay. Thank you. Problem statement. Unsafe abortion practices among teenagers at Asankregwa continue to pose a significant public health problem. not only in Ghana, but also in many developing countries in sub-Saharan Africa. Globally, unsafe abortions account for an alarming number of maternal deaths, with an estimated 47,000 deaths each year. In Africa alone, approximately 8.3 million induced abortions occur annually, leading to adverse consequences such as maternal mortality and morbidity. Despite the liberalization of abortion laws in
Ghana,
1985, the prevalence of unsafe abortions remains high, particularly among teenagers, contributing to approximately 12% of maternal deaths in the country. Factors contributing to the persistence of unsafe abortion practices among teenagers in Asankragwa include inadequate knowledge of abortion laws among the community members and healthcare providers, limited availability of comprehensive abortion care and family planning services, and weak capacity of healthcare workers and facilities to manage abortion complications effectively. These factors result in delay or inadequate care for complications arising from unsafe abortions, placing a significant burden on the already resource-constrained healthcare system. Furthermore, the Ghana Maternal Health Survey of 2017 revealed that 20% of women in the reproductive age group have experienced induced abortions due to unplanned and unwanted pregnancies, often resulting from low or non-utilization of contraceptives. This data emphasizes the urgent need to understand the underlying factors that contribute to unsafe abortions among teenagers in Asankragwa and address this silent pandemic which poses a critical public health concern. In conclusion, the persistently high rate of unsafe abortions among teenagers in Asankragwa, Ghana, despite the liberalization of abortion laws, highlights the urgent need to comprehensively understand the influencing factors behind these practices. By identifying and addressing these factors, it is possible to mitigate the adverse consequences of unsafe abortions and improve the overall reproductive health outcomes of teenagers in the community.
okay. So let's pause here and then go through. What is your observation in this? What did you observe in this problem statement? What have you observed? Has this problem statement captured what is needed for us to understand what is going on in Asankragwa?
Yes, sir.
Yes, please.
sir.
Yes. Yes.
Ophelia, what did you observe?
Sir, so in the problem statement, the person stated the factors affecting the factors that are causing the teenage pregnancies. That's
Wait, so let's go to that place.
okay.
Factors contributing to.
Okay, contributing to the persistence of unsafe abortion. And he mentioned
Inadequate knowledge of abortion laws amongst both community members and healthcare providers, limited availability of comprehensive abortion care and family planning services, and weak capacity of healthcare workers and facilities to manage abortion complications effectively. Now, here lies my question. If this person has read this work by Ruminsky and Mohi, and then these two works are saying that the factors that are contributing to unsafe abortion amongst teenagers is all of these things. Hasn't these two researchers done the person's work already?
Say, come again.
This study that this person wants to conduct, what's the topic again? The topic is factors influencing what? Factors influencing unsafe abortion practices amongst teenagers at Sankregwa.
Yes.
Now, the work by Ruminsky and Mohi have identified these factors already, right? Ruminsky and Mohi are saying that the factors influencing unsafe abortion practices are what? Inadequate knowledge of abortion laws, inadequate, limited availability of comprehensive abortion care and family planning services, and then weak capacity of healthcare workers. These are the factors that have been identified by Ruminsky and Mohi. Haven't Ruminsky and Mohi done this person's work already?
Yes, sir.
Yes.
Yes, sir.
Yeah, the work is already done. The work has already been done. And it has already been done in Asankregwa because the person says factors contributing to persistence of unsafe abortion practices among teenagers in Asankregwa, meaning that Ruminsky and Mohi did the work in Asankregwa among teenagers in Asankregwa, the same people that these students want to do their work on. So the work is already done. So what is the essence of this work now? What is the essence of this work now when the work is already done by someone else? And you have even gone to cite the person who did the work and mentioned all the things that they've said. So the work is done. So what new thing is this student going to add if the work is already done? And apart from that, did these students identify any problem in Asankregwa? Did you see them identify any problem in Asankregwa? Think about what you listened to and tell me, did you hear anything identifying a problem in Asankregwa that the work is going to solve?
No.
No.
No, please. No.
There was no problem identified. They started with unsafe abortion practice among teenagers at Asankregwa continues to pose a significant public health problem, not only in Ghana, but also in many developing countries in sub-Saharan Africa. This is definitely not the problem. Then from this statement, they now move to global because this 47,000 is global information. Then they move to Africa. Then from Africa, they later came down to Ghana. But have they mentioned anything concerning Asankregwa?
No, sir. Nothing like that.
Nothing like that. And they went on to say that this data emphasizes urgent need to understand the underlying factors that contribute to unsafe abortion among teenagers in Asankregwa and address this silent epidemic which poses public health concern. They have stated statistics on Ghana, and they are saying that that statistic on Ghana emphasizes urgent need to understand underlying factors in Asankregwa. How does Ghana statistic influence Asankregwa? It is possible that maybe the Ghanaian average statistic is high, but Asankregwa's own is very, very low and almost zero. It is possible, right? So how did statistic in Ghana influence them to now say that the data emphasizes the urgent need to understand underlying factors that contribute to unsafe abortion among teenagers in Asankregwa? Even the statistic didn't mention teenagers, so it just mentioned women. The statistic they are quoting just mentioned women. There was nothing on teenagers. So has this person effectively identified any problem in Asankregwa?
No.
No.
Sir, not yet.
No, I say not yet. Please, we come later. So they have not done a good job in the problem statement. They haven't done a good job in the problem statement. They have not identified any problem in Asankregwa. They have not identified any problem in Asankregwa. Yeah, Justina.
Sir,
Mm-hmm.
but if I'm not mistaken, I just heard you say that the problem statement side where the person he referenced has done the work already. So that's
Mm-hmm.
the factors that the factors that he mentioned, the person has done
Mm-hmm.
the work already at the Asankrikwa. So if you are
Mm-hmm.
telling us this, then I'm confused a bit here.
If I'm telling you
Because
what?
it's like you said, the person like that the he has not mentioned any problems relating to her the topic he wants to discuss or he wants to talk about.
Mm-hmm. Mm-hmm.
I'm a bit confused there because the person he's referencing said that you said that the person has already done the work there.
Mm-hmm. Okay, I don't know if
So
I
if you are
understand your
telling
question.
us that
I
the
don't know if I
problems that like
understand.
the factors influencing
I don't know if I understand your question, but then what I'm trying to say is that one, in your problem statement, you're supposed to tell us what the problem is in the community. What is the problem in the community that is making you do this investigation? That is what your problem statement is supposed to be about. What is the existing problem in the community that is making you want to do the work? So that means that you have studied the community and you found out what the problem is. This person is quoting statistics in Ghana, statistics in Africa, statistics in the world, but has mentioned no statistic concerning Asankregwa. But the person has also read a previous work that has investigated unsafe abortion practices in Asankregwa. And that previous work has listed out the factors that are contributing to the unsafe abortion practices among teenagers. Now, I was asking you, that work that was done by someone else, isn't that work too similar or almost the same thing or achieve the same aim as what the student want to do? Justina, this student wants to investigate the factors. Someone else has done a work in Asankregwa amongst teenagers in Asankregwa and has identified the factors contributing to unsafe abortion practices. Aren't these two works going to be producing the same result, Justina? Justina?
yes,
Hmm?
I can hear you say
Yes.
it
So I'm
will produce
asking,
the same portion.
it will produce the same results. So now the question
Yes, sir.
is, why would this student now continue with the work if somebody else has done it already? That is number one. Number two, have they really identified any problem in Asankregwa? Let's even say that this portion of the work does not exist. Let's say that even nobody has done the work before. But have they really identified any problem going on in Asankregwa? Have they?
No, sir.
No, sir,
They
they have
haven't.
not. Not at all.
They've not. So let's even if we delete the previous work that was done, and let's even say that the previous work was done in 2010 and 2016, that is over 10 years ago. Over 10 years ago. But even in current 2020, this person's work is 2025. In this current 2025, have they identified any problem? They have not. And they can even bring in a new perspective that maybe because of galamsey in the community, it might have changed abortion practices, right? So meaning that what was experienced in 2016 might be different from what's been experienced in 2025, but they still haven't identified any problem. After reading this work, they haven't identified any problem amongst teenagers in Asankregwa. They have not. So that's why I'm saying that their problem statement is not sound, because they have not identified any problem at all. They have not. They're quoting statistics in Ghana, in Africa, and in the world without emphasizing on where the population is coming from, which is where? Asankregwa. So that is where I have my problem stemming from. Okay. I hope we all understand.
Okay.
Yes, sir.
Yes, sir.
Yes, please.
So let us quickly.
Sir, please.
Yes.
So, with respect to this statement, can they limit it to the, if not globally or nationwide, as Ghana, can they limit it to the Asankagwa district, identifying the prevalence rate of the teenage pregnancy in the district and then descending to the community?
Yes, you can. At least that is more specific. You can even start global. Then you come down to Africa. Then you come down to Ghana.
Right.
Then you come down to the Asankregwa district. It is still fine.
Okay.
But you don't mention global, Africa, and Ghana without talking about Asankregwa. You must talk about Asankregwa.
All right. Thank you.
You're welcome. So let's look at the student's aim. Let me find someone else that can help us read. Hey, where are the rest of the readers? Index number 032321425. You don't have a name, that's why I'm mentioning your index number alone.
So let me continue for you.
Yes, please continue for me.
Aim of the study. The study aims to investigate and understand the factors that contribute to unsafe abortion practices among teenagers in the Asankregwa community. Overall, the aim of the study is to generate evidence-based knowledge that will contribute to reducing the incidence of unsafe abortion practice among teenagers and promoting their reproductive health and well-being. Objective of the study. Main objective, to assess the factors influencing unsafe abortion practices among teenagers at Asankregwa. Specific objective. 1, to determine the level of awareness of teenagers in Asankregwa or on unsafe abortion practices. 2, to access the knowledge of teenagers towards unsafe abortion practice. 3, to identify practices which influence teenagers to practice unsafe abortion. 4, to find if teenagers are aware of the dangers and complications of unsafe abortion practice. Research question. 1, do teenagers have adequate knowledge about unsafe abortion practice? 2, what practices which influence teenagers to practice unsafe abortion? 3, are teenagers being aware of the dangers and complications of unsafe abortion practice?
Okay, let's pause here and assess this person's aim and objectives. They said their main objective is to do what? To assess factors influencing unsafe abortion practices among teenagers in Asankragwa. Is this objective in line with their title of the work? Let me go to the title in case you've forgotten the title. The title of the work is Factors Influencing Unsafe Abortion Practices Among Teenagers at Asankragwa. That's the person's title, Factors Influencing Unsafe Abortion Practices Among Teenagers at Asankragwa. Now let us come to their main objective. The main objective is to assess factors influencing unsafe abortion practices among teenagers at Asankragwa. Is this main objective in line with the title or with the topic?
Yes, please.
Yes, it is.
Yes, sir.
Yes.
Yes.
Yes, it is in line. Yes, it is in line. So this one there, I will not fault the student. Their topic is in line with their objective. Now let us come to the specific objective. First of all, minus half. What is this zero doing in front of the specific objective? What is this zero doing there? Somebody will say another typographical error. They should keep on typing errors and they will keep on deducting marks from them. So please open your eyes when you're typing. Good. Now let's look at the contents of the specific objective. Objective number 1 was to determine the level of awareness of teenagers in Asankragwa on unsafe abortion practices. So we want to find out whether they are aware of unsafe abortion practices. 2, they want to assess the knowledge of teenagers towards unsafe abortion. 3, they want to identify practices which influence teenagers to practice unsafe abortion. And then 4, to find if teenagers are aware of dangers and complications of unsafe abortions. Okay, so 1 is awareness, whether they are aware of it or not. Awareness and knowledge are different. We know that, right? Do we know that?
Yes, please. Yes.
So awareness, are you aware of it? And then, objective number 1 is to find out whether or not they are aware. So we're okay with that. Objective number 2, to assess their knowledge of unsafe abortion. So that could be knowledge, the causes, the dangers of it, the complications of it. That will be part of knowledge, right? Do you think that should be part of the knowledge?
Yes.
Yes, please. Complications can be part of knowledge.
Yes. So if you are assessing knowledge here, and that knowledge can include the causes of unsafe abortion, where they get their unsafe abortions from, the dangers of unsafe abortion, possible complications of unsafe abortion, wouldn't this objective 4, can't it be part of objective 2? Look at it well. Can't objective 4 be part of objective 2?
Yes, sir, it can.
It can, sir.
Yes, sir, it can.
Can be part of objective 2. So that means that having objective 2 should nullify objective 4. If you have objective 2 there, you should not have this objective 4 there because it should be part of the objective 2. The only time you would want to keep objective 2 and 4 is if you specify exactly the knowledge you're assessing in objective 2. For example, in objective 2, the person said to assess the knowledge of the causes of unsafe abortion practice. That is fine. To assess the knowledge of the possible means of unsafe abortion practices. That is also fine. But they have left it vague. They have left it non-specific, meaning that they are assessing all knowledge concerning unsafe abortion. So that means that objective 4 should not be there because it should be part of what is being assessed in objective 2. So that is one another issue that I have found. The objective 2, if you maintain it, that means the objective 4 should not be there. It should be rather part of objective 2. Are we all in agreement?
Yes.
Please, is it compulsory to have main, objective, and specific? Can't you combine both?
You can't combine. The main objective or your aim is what you are trying to achieve at the end of your work. But then your specific objectives are the individual things you are going to be doing in order to achieve the aim. So the person wants to find factors in general, but then their first objective was to find out their awareness of the teenagers. Then come to their knowledge. And then you see the only factor this person is investigating is knowledge. That is the only factor this student is trying to investigate, which is what? Knowledge. Yes. They are not looking at any other thing. They're only looking at what? Knowledge. So even this student's objective would not entirely allow them to investigate so many factors. The way their work is framed, they are only assessing knowledge. So that means that even these specific objectives are not so well in line with the main objective. They are not so in line with the main objective, because if you look here, you will see that all they are assessing is knowledge. That is the only factor that they are really assessing, knowledge. To assess knowledge, to find if teenagers are aware of all those things and knowledge things they're talking about. So what they are looking into is knowledge, but the main objective is too broad that it's supposed to fit in so many other factors apart from only knowledge. So if I was this student supervisor, I would have collapsed some of the objectives and added new objectives to it. I would have even looked at background characteristics, maybe whether their level of education could be an influencing factor. Maybe their economic status can be an influencing factor. Maybe their marital status can be an influencing factor. So you could assess knowledge, you could assess socio-demographic factors, you could affect even obstetric history, whether their obstetric past influences the practice of unsafe abortion. So all these things could be looked at, but this student focused on only knowledge, and yet their main objective is factors in general. So their main objective is broad, but their specific is too narrow to allow them to accomplish the main objective. I hope you understand what I'm saying.
Yes, please. Yes.
Even their
You say?
I said, and even their cultural practices.
Cultural practices, yes. All these things could have been looked at, yes?
Please, but the number 3, is it also on the knowledge?
To identify practices that influence teenagers to practice unsafe abortion, what practices are they referring to?
It can be different factors. Like what?
Will social demographic factors fall under practices?
No.
Will cultural beliefs fall under practices?
Yes, it can.
Cultural beliefs fall under practice.
No, I think the belief is something that will influence them, but it's not something they do. The belief is not something Practical.
Anyway, let's move, because personally I don't see how the practice and what practice are they referring to anyway. Since the student is not here to justify themselves, but then from based on what I'm seeing, the work is focusing mostly on knowledge. That's what I'm seeing. As for what they mean by practice, is open to interpretation. But from what I'm reading, I think the work mostly skewed towards knowledge than anything else. And it is too narrow to satisfy the main objectives. It's too narrow to satisfy the main objective. But let's see whether the objectives are in line with the research question. I've told you that your objective must be in line with your research question and arranged accordingly. So the first objective is what? To determine the level of awareness of teenagers in Asankragwa on unsafe abortion practices. And then question number 1 is, do teenagers in Asankragwa, do teenagers have adequate knowledge of unsafe abortion practice? Is objective 1 and research question 1 in line? Objective 1 and research question 1, are they in line?
There.
Mm-hmm.
I'm confused with the the practices.
What is your confusion?
Say the practice, can't it be like what they are using to
How they are performing the unsafe abortion?
Yes.
But would that be a factor?
Oh no. Okay.
So I suggest it's somehow in line, because they said they wanted to determine the level of awareness of the teenagers. And they came to ask that, do the teenagers have adequate knowledge about the unsafe abortion practice? So I think it's somehow slightly in line. Thank you.
Knowledge and awareness, are they the same thing?
No, sir.
They're not.
No, they are
Their
not.
question 1 rather goes with their specific objective number 2.
Yes.
Yes.
Question 1 is more in line with objective 2.
Question 2.
So that means that already there is a problem with the arrangements. When you are doing your research question, make sure it is in line and arranged accordingly with your specific objectives. So that means that an appropriate research question 1 would have been, what is the level of awareness of unsafe abortion practices among teenagers in Asankragwa? That would have been an appropriate research question 1. What is the level of awareness of unsafe abortion amongst teenagers in Asankragwa? That would have been a good research question 1, because it will be in line with the objective. Now let's come to the objective 2. What the research question 2, what practices which influence teenagers to practice unsafe abortion? Now, even the phrasing of the sentence has me confused. Even the phrasing. What practices which influence teenagers to practice unsafe abortion? I'm confused. I'm confused. So sometimes you can have the right essence, but then the phrasing is wrong, and then it affects the interpretation of what they're trying to say. So I believe that this research question 2 was supposed to be in line with objective 3. Do you see that?
Yes, sir.
Yes, sir.
It was supposed to be in line with objective 3. Now let's look at the last. They had 3 questions. The third question was, are teenagers aware of dangers and complications of unsafe abortion practices? This is supposed to be in line with objective 4. This is in line with objective 4.
Please, I think the objective one, they mention awareness.
They mentioned awareness, but they are mentioning awareness of the unsafe abortion in general. But for the 4, they want to find out awareness of the dangers and the complications. So they were more specific in the 4. They were more specific in the 4. So the research question 3 was supposed to be in line with objective number 4. So there is no reason for you to have 4 objectives and 3 research questions. If you have 4 objectives, you must have 4 research questions. If you have 2 objectives, you must have 2 research questions, and they must be in perfect sync. If you have research question, non-research objective 1 is this, the research question 1 should also be talking about the same topic or the same subject. So if they are talking about awareness in objective 1, research question 1 should also be on awareness. The objective 2 is on knowledge. Research question 2 should also be on knowledge. The objective 3 is on practices. Research question 3 should also be on practices. So they should be arranged accordingly so that the person who is following in the right order. So that is the issue with these students' research question and objectives. Now let's go on. For the delimitation of the study, you are just stating how you intend to narrow the work to a specific population. And according to this student, they are narrowing the work to teenagers in Asankregwa. So this part, and then they have also gone ahead to define some essential terms like abortion. But I don't know why they've defined abortion twice. One definition is coming from WHO. The other definition is coming from American College of Obstetricians and Gynecologists. One definition is supposed to be enough. 2 definitions, I don't know where you're going to with it. 1 is okay.
Say for more points.
From who?
From you, because you are the doctor number, so that one go. And then what question say?
Let me laugh. Hey, this is even going to deduct marks from them. So yeah, more definitions, and after definition, they will move to their methodology. So let me take you through the methodology. In the methodology, they had the introduction. This part is not really important to me. Let's come to the study area. In the study area, they said they are going to conduct the study in where? Father Thomas Rooney Catholic Hospital at the Amenfi West District. And they've given us a brief, something brief about the district, the population in the district, the percentage of the district in terms of regional population, the percentage of males and females in the districts. They told us those who are living in rural areas. And then the sex ratio. How is it 105.7 people? And then population of the youth in the districts. And then there is also the total age dependency ratio. So they've given us so much information on the district, but they are stating that they're going to conduct the study in the Father Thomas Rooney Catholic Hospital. So that is the study area. They've gone ahead to even give us further information on the Father Thomas Rooney Catholic Hospital, that it is within the Amenfi West District, that it is the biggest hospital and a referral center in the region. And then it has about 300 beds. They have different units, including the pediatric, therapeutic, emergency, surgery, maternity, and labor ward. There is also an outpatient department. There's an open health unit and then a lab So they've given us a brief little information on the Father Thomas Rooney Catholic Hospital. Now let's come to the research design. For their research design, they say they want to conduct a retrospective cross-sectional quantitative study. Retrospective means that they're going to the past. They're collecting data that has already been accumulated. So maybe they'll go to their hospital records and get the data from them. They'll go to the hospital records and get data from them. But it's going to be cross-sectional and it's going to be quantitative. And then the study population is going to be teenagers between the ages of 13 to 19 who seek post-abortion care at Sankregua Catholic Hospital from 2023 to 2025. Question: have you seen any difference in the name of the facility?
Yes.
Yes, sir.
First, it was what?
Father Thomas.
Father Thomas Rooney Catholic Hospital. Now it is what?
Asankregua
Catholic
Hospital.
So now, which facility are they conducting the work in? Now we are confused. Now we are confused.
Now they have to.
The signs of grandfather. So the grandfather must have been the Asankregua. I don't know. But how? And then apart from that too, let's look at the inclusion criteria. Inclusion criteria of patient participants include teenagers who had what? Self-induced or sought services of untrained personnel to terminate their pregnancy and were being treated for complications of unsafe abortion. But the name has changed again. It is now what? Asankregua Hospital, no more Catholic. The Catholic has now disappeared. Now, look at even how they have spelled their Asankregua.
It's the same name, it's the same name. That is how sometimes they call it.
Asankregua Hospital, Asankregua Catholic Hospital.
But the spellings are different.
Father Thomas Rooney Catholic Hospital.
Yes, please. It's the same hospital.
One hospital, 3 names.
Some call it Asankregua Catholic Hospital. Some also call it Father Thomas. It's the same name, but at least...
What is the name on the hospital signboard?
Father Thomas Catholic Hospital.
So that is the name of the hospital. Every other name is unofficial.
Yes.
But you're preparing an official document. Yes. Somebody was asking a question. Yes, I'm listening. What's your comment?
Hello.
Yes, go on, Christina.
Hello.
Yes.
Hello,
I can hear you.
Please,
I can hear you talk.
I want to find out. I want to find out, was the work being supervised?
This is the proposal they submitted to me.
I said, was the work being supervised? Because what you said the last time. Oh, okay. All right.
So this work hasn't gone to supervision.
That's what I want to find out, because 3 names at the same time there.
At the same time, yes. 3 names at the same time. So this is a proposal that one of your colleagues wrote to me to assess, to score them for their research methods class. So that is where I'm getting this one from. So look at even the name Asankregua. The spelling is changing. Look at what I've highlighted. Ending with GUA. Now it's ending with GWA. Let's see how else they will spell Asankregua. Let's go to the topic and see how they spelled it. In the topic, they spelled it GUA. So is it the UA or the WA? Which one is which? My Asankregua people.
Please, it's
which is the correct spelling?
It's WA.
WA.
So how did GUA turn to WA and turn back to U? I'm confused. So the work need the
Pressure, no.
I say pressure.
Pressure.
Please, there's no pressure. There's no pressure. She had 3 weeks to submit this work. 3 weeks. So where is the pressure? Where is the pressure? Where's the pressure? Then let's come to exclusion criteria. Patients below 13 years were excluded, and those who were not consented. Okay, let's come to their sampling. They said they calculated a sample size. How would they calculate it? They didn't show us how they calculated, but they said that they used purposive and simple random sampling. We have already done sampling methods, so you should know what these sampling methods are. Purposive and simple random sampling. That's what they say that they did. Then, data collection procedure. They said they used a questionnaire. Which was distributed by the researchers. So they collected their data using questionnaire. Data analysis. They say that they used a software called SPSS version 20 and Microsoft Excel 2016 for their data analysis. And they presented their results in frequency tables, in pie charts, and then under various teams in order to make interpretation and analysis easier. So this is how they said they will analyze. Remember, this is a proposal. So they are telling us what you will do, not what you have done. But if you read this person's work, they are telling us what they have done. I don't know if you've spotted it. Let's look at from the study. Let's start from research design. In proposals, you are telling us what you will do, not what you have done. So you're using future tense. You're supposed to use future tense in your proposal. But in your main project work, you use past tense because you're telling us what you have done in the main project work. But in the proposal, you'll be using future tense because you tell us what you want to do or what you intend to do. So they said that the study employed past tense. So they have done the work already. Science of grandfather. They have done the work already. Then they came to study population. The study population consisted. It has been done already. So science of what? Grandfather. Science of grandfather. Inclusion criteria. Inclusion criteria for patient participant included past tense. So they're telling us what they have done. No, they should tell us what they will do, not what they have done. A proposal is communicating what you intend to do, not what you have already done. Shine, what's your question?
Sir, please, my questions are two.
Mm-hmm.
The first one, it was about the definition of terms.
Mm-hmm.
I want to ask that maybe sometimes our handouts and slides, you see that the lecturer will be defining, maybe let's say the lecturer is defining labor or something. They will bring a lot of definitions of that particular labor from different references. Is it also wrong? Because you
It's not
said with
wrong.
the work, so
It's
but you
not
said
wrong.
with the work here, one definition is enough on a
One
particular.
definition is enough. But this is not a lecture. Your proposal is not a lecture.
Okay.
It's a summary of a work you intend to do. It's not wrong to have multiple definitions, but you don't get extra points for the multiple definitions you're putting in there. So one is okay.
Okay.
If the one can appropriately define everything you need to say about the term you are using, then one is okay.
Okay, sir.
You
So
don't
then
define one single time multiple times. Yeah, go on.
the second question is about the results representation that we are doing now. He said we should use future terms because it's not the main work. I want to ask that after you submit the proposal and then you realize that you want to change what you want to do with what, can you change it in the main work? Or once you submitted what you submit, you have to use that?
No, the proposal is a proposal. It's supposed to serve as a guide. But after your proposal, so many things change after proposal. So when you're doing the main work, so many things will change. So it's okay to change those things. It's okay to change them. You don't have to stick because it is in your proposal. They have to stick to it. No. There are some times that it was practical when you were doing your proposal. But when you start doing the main work, you realize that it's not practical. I even had students, when they submitted their proposals to me, they had 4 objectives. But after they are done with their work, they realized that they were able to do about 3 or 2 of the objectives. So they delete the other objectives and they stick to the 2 that they've done. So that you have written it on the proposal doesn't mean that you will have to follow that thing to the very end, and even if it kills you. No. So that is in your proposal doesn't mean you have to die with it. You're allowed to adjust.
Okay, sir. Thank you.
Okay. Are you okay?
Yes, please.
So note that in the proposal, especially in your chapter, in your methodology, you are supposed to be using future tense. Anytime you're using past tense, is implying that you have done the work already. It's implying that you've done the work already. So the person said that they have already they collected data, they collected data already, and they've analyzed it by using SPSS version 20 and Microsoft Excel 2016. And results was presented in frequency tables, pie charts, under various themes in order to make interpretation and analysis easier. Let's look at ethical considerations. So what ethical considerations did they observe? They said that since this study involved human subjects, protection of participants' rights was ensured. This included rights to privacy and dignity, and right to anonymity and confidentiality. The right to freedom from risk of injury and right to refuse to participate. Participation was voluntary and the principles of informed consent was ensured. The researcher made sure participants had full understanding of the study. No name was added to the questions with the reason to ensure anonymity and confidentiality. I am having a problem with this ethical consideration. From this ethical consideration, you would think the person is right in front of the patient, right? Or right in front of the researcher. They went to ask for permission. They went to, they gave privacy to them to fill the questionnaire. That's the impression you're getting, right? Is that the impression you're getting? That they deal directly with the participants?
Yes, sir.
Yes, sir.
Now let's come to data collection. No, not data collection. Let's go to the research design. They said the research design is what? Retrospective. It was a retrospective study. So possibly getting the information from the folders of patients, right? Retrospective, you're collecting data from past. The person is not in front of you, but collecting the data from the past. So the folders that they had. So if you're collecting the information from the folders, how are you ensuring Doing all this permission.
Privacy.
How are you ensuring all these things? The right to privacy, to dignity, risk of injury, right to refuse to participate. You already have the person's folder. How are they refusing to participate?
Confident.
So you see where the disconnect is coming from.
The folder was refusing to open.
The folder was refusing to open. So you see where the problems are coming from. You say you are doing retrospective study, meaning that the patient has been discharged and the patient is long gone. You're just dealing with the patient's folder, and yet you're stating all these things. So that is where we get some of you. Then validity. This is to ensure that the questionnaire you are using can collect the data you actually want to collect. And I said that the instrument for data collection was validated by their project supervisor. So the project supervisor validated the questionnaire that they used in collecting the data. Now let's come to the expected outcome. We know that expected outcome is part of the proposal. So what are they expecting to see after their work? This study will identify factors influencing abortion practices among teenagers at the Sankregua, including socio-demographic factors. Was this included in their objectives?
No, sir.
No.
Economic factors, was it included?
No, sir.
No, sir.
Cultural factors, was it included?
No, sir.
Healthcare related factors, was it included?
No, sir.
No. So none of these things they are saying came up in their objectives. So you see that if they had stated these things in the objectives, there would have been no confusion in the objectives. Would have said, oh, they have gotten, they have gone in depth to determine the factors. But now the only factor they were discussing up there seems to be knowledge.
Yeah.
Meanwhile, they had a lot. It's either they copied this portion from someone else, or I don't know where the disconnect is coming from. Because if you are doing knowledge over there, knowledge should also be appearing here. But if you are doing other things like the social demographic, economic, and cultural, they should also appear in the objectives. So I don't know where the disconnect is coming from. And then the findings of the study will inform the development of targeted interventions to prevent unsafe abortion practices among teenagers, including education, counseling, and healthcare services. The study's findings will highlight the need for improved access to safe abortion practices, including post-abortion care, and will inform efforts to increase access to these services. Their expected outcome is not bad. It's not bad at all. Now let's come to their conclusion. In conclusion, the study on factors influencing unsafe abortion practices among teenagers at the Sankregua will provide valuable insight into the complex factors that contribute to unsafe abortion practices among teenagers. The study findings will inform targeted interventions, policy development, and healthcare services, ultimately reducing maternal morbidity and mortality, and promoting the health and well-being of teenagers. This is also a good conclusion. And they say it will provide, it will, future tense. Now let's come to referencing. In the referencing, we want to ensure that all the references you have cited in your main work are also appearing in the list of references. Now let's go to the main work. Let's pick one reference and see if you can find it. There's Ganatra and Tunkaup, 2014. Let's see if you can find Ganatra and Tunkaup. Can we find Ganatra? Can we find Ganatra? 2014.
Yes,
There's
sir.
no Ganatra 2014 here. Oh.
Sir,
Okay,
Yeah,
there is.
there is so.
No,
in
2010
front.
to
Why is it appearing
2014.
2 times? Why is it appearing twice?
Sir, please, there's
Type.
error. It's error.
That's a
Typing
mistake.
mistake.
Okay,
Typing error.
it's a typing error. The 2017 has appeared 4 times.
Hey,
1, 2, 3, 4.
Typo. Sir,
I said
probably
typo.
maybe their
First one is typo.
laptop
Second
was
one is
showing them.
intentional.
No.
But
Hey,
show more reference to get more
because
marks
that's not
because already
the intent.
we're losing
It
so
was
many.
the laptop.
it was a laptop. Hey,
Mm.
Yeah.
keep on defending this person. Hey. And then
Or
look at
say,
this one too.
maybe
Repetition.
they think that the number of times they have
They
mentioned
number of
that
times
in
they
the
mention
work
it.
should also be part of the reference, not just one, maybe.
No, it shouldn't be so. So this should serve as a point of correction for you. If you've cited the work 10 times in your main document, only list it once. Only list it once in your references. Only list it once in your. You don't need to list it 4 times or 10 times. No, just once is enough. Just once is enough. Because this one, yeah. Hey, babe. And then look, another one, another one, another one. And then WHO2 being repeated. Another one, another one. So this person, yeah, at the end of their work, how much do they deserve over 10?
4/10 now.
4.
10
4
over
crowd
10.
also. 4 is a lot. 4 is a
7/10.
lot. Hey, who's saying 7? Hey,
9.5 over 10. 9.5.
Christina, I'm going to take your marks and give it to that person.
Sir, 10 over 10. Sir, 10 over 10.
5/10.
10 over 10,
I will
sir.
take your marks and I'll give it to that person. Hey, for this poor work done. Oh, no, 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 no,
Sir,
no.
10 over 10, please. Please.
The work is poor. The work is very, very, very poor. The work is poor. I think maybe 2 over 10 is what this person deserves.
Hey,
Hey,
two
student.
students.
Ah,
So
one for the pen, one for the pen, another one for the printing, another one for the typing. Ah,
What of
hey.
the conclusion?
Abutre.
And you see, after the
Sir,
work,
what about the energy? Energy and the effort.
0 for energy and for effort. We don't mark energy and effort. You see, after this, there is no timeline. Do you see that? There is no timeline. The last page is page 19. Page 18 is references. There is no timeline. There is no timeline. So they don't include a timeline for the work, which is an important component of the proposal. They've not included the timeline. And the timeline should be presented in form of a Gantt chart. It should be presented in form of a Gantt chart. So this person's work they have problems with it. They have serious problems with it. So at the end, I think even if I'm gracious, 3 over 10 would be the most they'll get. 3 over 10 is the most they'll get. Yes?
Please, what is the timeline? Can you show us an example of the timeline?
Hey, you have not read the slide I sent to you the last time. Oh, you have not read the slide. You haven't read the slide. Let me find you an example of the timeline. I think that was presentation 5. This is the timeline. I showed you this last week. The timeline being presented as a Gantt chart. According to this person's timeline, they are going to do their planning between January 2019 to March 2019. Research will be done from February 2019 to March 2019. Design will be done from March 2019 to April 2019. Implementation from April 2019 to July 2019. And then follow up from June 2019 to July 2019. This is how we want the timeline to be. It's represented in a Gantt chart. Represented in a Gantt chart. So you have seen it before. It is you that haven't studied it. It's in the slide I sent to you last 2 weeks. So is it 2 weeks or last week? Last week. So you haven't read the slide. You yourself, Wama, for me to know that you haven't read the slide. So with this, we are done reviewing the student's proposal. Any question? Do you have any question? In the absence of any question, then we might have to bring our class to an end. But note that from today, your 3 weeks begins. Today is 8th March. 3 weeks from today is 29th March. By 29th March, you should have submitted your proposals. I would send a template of the proposal to the group, to your reps, for them to share with you so that you know how it should be like. So when I send this thing to you, then you make sure you abide by that format. You abide by that format. Belinda, what's your question?
Sir, please, my question is, in submitting, are we all the 5 members to submit or only one person?
Your name would be on the document, and then only one person should submit the work.
Okay, please. Thank you.
So you're submitting it as a group. It's a group work, so you're submitting it as a group, a single group. Yeah. Yes.
Sir, please, for hours, the timeline, should that be between the 3 weeks, or?
No, the timeline is timeline for your project, not timeline for the proposal.
Oh, okay.
And then you're starting your timeline because by September 2026, you'll be in your level 300. So start counting in your level 400. So start counting from September 2026. Yes. Elizabeth.
Sir, please, can the number be more than 5?
No, it should be exactly 5.
Okay.
Okay. After Elizabeth, Janet.
Hello, sir.
Sir, please, if we are counting from September, how long is it going to last? Is it going to be like 2 months, 3 months, or that's
September? Count from September to maybe April.
okay,
September to April. Yes.
Okay, thank you.
You're welcome. Idris.
Sir, please, the proposal, we are presenting it in a group format.
Yes.
And you will pick a leader who will present, or?
No, there will be no presentation. You just submit it to me, then I'll review.
Okay.
Presentation.
At work.
You submit it to your rep, and your center rep will submit it to me.
Okay.
Okay.
Thank you.
Irene, what's your question?
Sir, please, the group work, is it every center? Maybe as Sankragwa, you should have your group. Mase should have like your group, or we should combine the centers. I don't understand. I don't know how.
What center are you in?
Asanko.
So all your group members must be in Asanko Center. So all 5 of you must be in Asanko Center. You can't have someone else from a different center joining you.
Okay. Thank you.
So when you are done with your proposal, submit your work to the rep, and the rep will submit it to me.
Okay, the rep, Asanko rep.
Asanko rep, yes.
Okay.
Judith, what's your question?
Sir, please, should the assignment be in software or hardware? Or
It
soft
should be
copy or hard copy?
soft copy, Microsoft Word. It should be Microsoft.
Thank
you. You're welcome. Shine.
Sir,
please.
Last week's slides, we don't have it on my center.
Then I've not sent it. I'll send. Please, sorry, I forgot. You guys should remind me on the group page if I forget. Sometimes when back for crowd, if I forget, you have to remind me. So
Yes.
I'll send it today, please. Sorry about that.
Okay, sir.
Okay. Portia.
Sir, please, my center, after we've shared the five names, it's left with 3 people. So what do we do about it? Yes,
They
please.
should form one group.
Okay. Thank you.
Those of you that laughed at me, boy, and Akokra, I have seen you, and I'm deducting 20 marks from all of you. All of you that laughed at me, boy, and Akokra, I have seen you, and I'm deducting 20 marks from all of you.
But I said the thing we haven't done anything. We are deducting marks from us.
Yes, preemptive deduction.
Future
Preemptive
arrears.
deduction. Yes, so you're owing me. You're in negative 20 already. Irene, do you have another question? Your hand is still raised. Okay, I think you don't have any other question. Amma Azari. Ama.
Sir,
Yes.
please, with the defense, will we do it online or it will be in person?
You will not be defending your proposal, but your project work you will defend, and that one will be in person. We will come to your center, and then you will defend there. Which center are you in?
Koforidia.
Koforidia. So we'll come to Koforidia, and you will defend to us in Koforidia.
Okay.
So you and your group members will come and defend.
Okay.
All 5 of you will defend. Everybody will talk. Everybody will talk. And if you don't talk, if I come to your center and I see that one person is not talking or not presenting, I will target all the questions for the group to that single person.
Hey, sir.
I'll target all the questions to that single person. So please, when I come to your center and you see me there, make sure you are talking. Make sure you are talking. Peace.
Please, does that mean a group is taking one topic? All the members are writing one. Okay.
Yes, you're writing one thesis, one document. So all of you are contributing to that single document.
It's okay. Keep quiet.
No, don't keep quiet. Don't keep quiet. Tell me. 1,003. Tell me. 1,003. 1,003. 1,003. Tell me. They will G you 2,000 and they will submit nonsense and I'll give you 0. They will G you 2,000. And they will submit nonsense and I'll give you 0. Keep talking. Mamekia. Yes. Yes. Shine, what's your question?
Sir, please, my question is with the reference. You said that whatever recited during the work should also come at the referencing side. So I want to ask that what if you have another reference that wasn't cited at the work? Can you add it?
Every work that you have, what is it? Every work you have used must be cited. There is no option for you to not cite a work and have that work come in the reference. Then where is it coming from? Okay. All the work that you have used in your research must be cited. They must not option. You must cite them. Yeah.
All right. Thank you.
You're welcome. You're welcome. Mariama.
Sir, please, good morning.
Good morning.
Please, sir, are you the one who is going to give us the questions or we'll choose them by ourselves?
You choose your topics yourself. You choose your topics yourself, yes.
So what if we choose a topic and maybe another group also choose the same topic? How about that?
It will be between you and your supervisor. My work is to take your proposal and grade your proposals and use it to assess you at the end of this semester. But as to the final work you do is between you and your supervisor. So if your supervisor thinks that it is being done by someone else, they'll tell you to change. But mine is to make sure you know how to write the proposal, except for those who want to go and let them J them 1003, 1004. But yes, you doing the work has to do between you and your supervisor. I will not be involved unless I am your supervisor. Then all the topics you bring I will bounce it. I will tell you it has been done. It has been done. And you decline.
You're laughing too. Say, stop laughing. You're laughing.
Why shouldn't I laugh? You see it. Throughout the semester, throughout your stay, you always get me. You always get me. So research work is an exam. It's the only time for me to get you. Rhoda,
say what you're not supposed to say.
Say everything, no. Say everything so I can hear. Say everything so I can hear. Rhoda, what's your question?
The person you are bringing here. So, sir, are you coming all the way to Asankregua?
Hey, I was there last year.
Christy, mute them.
I was there last year. I was at Asankregua last year.
Oh,
last December. Yes, 22nd.
Then
22nd was it?
Some of us who don't.
Yes. So ask the level 400s there now. They will tell you I was there last year when they wrote my paper. And they were crying. So don't worry, I'll come. Phoebe, what's your question?
Please, I wanted to know the maximum pages that I'm supposed to write and the mode that we can send the work to you.
Oh, that is Phoebe a rep, right?
No.
So just forward your work to the rep. The rep is the one that will forward it to me. I'll tell the rep how to send it to me. So just forward your work to your rep.
Okay. So in the pages, it should be maximum. How many pages and minimum?
Your work should not, the proposal should not be exceeding 10 pages.
Okay.
It shouldn't be exceeding 10 pages. Yeah.
Okay.
You're welcome. You're welcome. Unless Mami Equia has something else to say again.
Hello, sir.
Yes.
This proposal that we just worked on, who send it to us?
Well, what send what to us? No, I'm not sending this to you. This is someone else's work. You can't have it.
Oh, I want to follow the topics.
Oh, you can't follow the person's topic. It's a different topic from yours. So I'll send you guys a template to use to build yours.
Okay.
Yes. So start working. Don't wait until the deadline is up. Then you're running helter-skelter. Start working now. Okay. So with this, I can comfortably bring our class to an end, and I believe it has been productive. I hope you have learned what not to do. I hope you have learned what not